Looks like we have some question. Yeah.
I'm just wondering how you talked to Daphne about her delusional beliefs. Did you ever did you propose that this may not be real? How did she sort of gain the insight, the going from the sort of to a more solid, grounded place?
Well, we each have to operate within the constraints of our own personality, and I can probably tolerate something like that for a month, 2 months, and then I begin to start to do some reality testing. But the most important aspect of it is to just get the patient to talk about it, because when the patient's talking about it, it becomes clear to them that they're mixed up. And Courtney really touched upon it in this morning's presentation, in which she talked about the inherent integrity of the individual and the healing capacity of the individual. So in some way we just want to get out of the way of the patient, but we have to clarify and help make conscious to the patient in some way that in fact they are confused. As far as Mary was concerned, as far as Daphne was concerned, Mary was a different person, but as we talked about it, the mere process of inquiring began to drive a wedge between her and her conviction that, in fact, Mary was a real being. As she explained the history of how Mary had developed, the different threads that were interwoven, it became clear even to Daphne. When she jumped off the Golden Gate Bridge, it was never clear to her what had happened. She was seeing an eminent psychoanalyst trained at Chestnut Lodge, who knew all, he'd worked with Frieda Fromm-Reichmann. It was analyzed either by her or one of her buddies, but he never really put this kind of work to use. My own sense is that when she did that, that would have been a very desirable time to make clear to her by inquiring about the history of how that had happened, that she was delusional. Unfortunately, he didn't do it, and he's not alone. Most analysts, most therapists are frightened by patients as severely disturbed as Mary, as Daphne, and tend to shy away, from really getting into the guts of what's going on. Yeah.
Yeah, how would you differentiate your approach from the therapists who work with severe dissociative disorders, identity dissociative disorders?
No difference at all. I've talked before various groups that use hypnosis to treat dissociative disorders, and we tend to disagree about it. A patient of mine, a very severe multiple personality, wrote a book about our treatment, and essentially I was pilloried in the internet comments because I didn't believe in the existence of many different beings. And when I've talked to groups at various seminars and meetings where hypnosis is all the rage, they've ended up saying, well, Dr. Steinman, you don't do hypnosis, but your questioning and your use of imagination is a hypnotic technique. It really isn't. My own sense is that hypnosis tends to worsen some of these severely disturbed people. No, I think it's very important whether someone is a dissociative disorder, a schizophrenic, paranoid disorder, to really inquire into how these things began. And you don't even say, well, now how did these symptoms begin, or how did you get so messed up? You don't really talk like that. You just talk like we're talking, and someone brings up an additional personality of some sort. Oh, well, yeah, so how'd you come around? What's the story? And gradually the situation becomes clearer, and the patient is often able, just in the course of our interaction, to realize how mistaken they've been. Yeah.
When Daphne was working on giving up Mary, was she acknowledging to you at the same time that you were becoming more important to her?
Yes, no, and both. Obviously we had a relationship, we'd made contact. I think we made contact in the very first session where I said, what are you looking at? I mean, I think that to her was like a big-time interaction with somebody. But no, as long as she was under the domination and sway of Mary, no, there was always, a tendency not to talk about the importance of the therapeutic relationship. Yeah.
You know, Ira, another piece of this is you reveal in talking to us and mixing up Mary and Daphne.
Right. I needed that, Dan, thanks.
No, I think it's very positive. Because in fact, I think that Mary, even though she was delusional, that's our word, but for Daphne, she was a creative aspect of her own identity.
Absolutely right.
And as she explored another aspect of her own identity, Daphne, becomes Mary, and Mary becomes Daphne, because
Right.
there's one identity. But you know, Mary was quite important to her, obviously, important in the sense of psychic survival. How else was a little girl to survive?
Right.
To create and hold dear her own identity in this form. And as she began to discuss that identity with you, you took it seriously, as you still do to this day.
I'm not quite sure which is which, right?
Because they're the same. And she picked up from you, I'm sure, what we're picking up from you. A sense of seriousness and the reality of her life, part of which was Mary.
Yeah, no, you're absolutely right, Dan. And in my book, I emphasize this point that what we're calling the symptom, the delusion, the hallucination, the paranoid disorder, the multiple beings who are there are a creative act on the patient's part, an attempt to deal with an overwhelming, very difficult situation. So in taking it seriously, as you say, the patient can begin to see it in a somewhat different way. At the same time, we all have to follow our own natures. I tend to kid around with patients too, so I'd kid around with Daphne, I'd kid around with Mary. And little by little, some beachhead of rationality began to emerge. Yeah?
Are auditory hallucinations generally linked to delusions?
Not necessarily. Not necessarily. I mean, a person can hear voices. They don't necessarily have to have a delusion. I mean, if you get into it, perhaps there is some delusion that emerges or is unconscious. But no, not necessarily. And a person can hear voices, and it's the same thing. Huh, wonder what that means. You've been sitting at home alone for 3 months, and you haven't washed much, and you look terrible. I can't believe that you're wearing these 40-year-old clothes, and yet you're convinced that Robert Redford is coming over tonight because he told you that through the television? Okay, let's try to make sense of that. I mean, whatever the case may be, you have to try to understand, and obviously if someone first broached it, I wouldn't be as sardonic or as sarcastic as that. I would, wonder about it in a nice way. But you want to just enter into it and try to make sense of it for several reasons. The most important is to try to help the patient to get some distance from their creation. But it's inherently interesting. Here I am at this age, still fascinated by the work, and I have so many colleagues who just love this work that we've been doing for 40 years and will probably continue doing for quite a number of years in addition, because it is so fascinating, and still fascinating, how the human mind and its creative capacity can build all these hallucinations, delusions, and our job is to register it, empathically be there, and little by little help them to get to be more like us. Yeah.